Well, my name is Nwokeji. Thank you for having me. I've been in Houston. I've practiced in Houston for 20 years, and prostate cancer has always been a big part of my practice. Prostate cancer is very special to me because it runs in my family. My father had it, and several of his cousins and brothers had it. And when I went into urology, that was something I was very keen to. So that's why I've always kind of enjoyed the process of treating patients. And it's just been a big part of my practice. Well, during my training at Southern Illinois University, I was very aware of all the different treatments of the conventional treatments of prostate cancer, and I was made aware of this HIFU technology that was very much in its infancy. I followed the data, and in 2007, I then decided I wanted to be part of the conversation regarding minimally invasive treatment for prostate cancer because I always felt that that would be the future. So I've been involved with HIFU since July of 2007. I chose Sonoblade because the numbers look better to me compared to the other technology. Moving forward, when I did my first patient, I waited a good 9 months before I did my second patient to see how the outcome would be. And in terms of his quality of life and the PSA control and the biochemical treatment of the cancer, I was very impressed. And that's why I decided to stick with the Sonoblade technology. Well, men, back in the days, once you were treated with prostate cancer, whether it be radiation or prostatectomy, as far as the prostate cancer was treated, your quality of life was not an issue because people weren't doing well. They were incontinent, they were having issues, bleeding. But as men have gotten older and the technology seems to have improved, men are more interested in their quality of life, not just the cancer control, but also living as close to normal lives as they can. And that's important to men. It's not just treating the cancer, but it's also maintaining their quality of life and having a life after cancer treatment.
How many cases have you done?
I've been doing Sonoblade HIFU since July 5th of 2007, before it was FDA approved. In fact, I was one of 4 urologists to give testimonials at the FDA trials in DC in 2014, a year prior to it being FDA approved for prostate ablation. Regarding how many cases, I've done hundreds of cases. I lost numbers, but I've done hundreds of cases. Prior to its approval, we would all kind of help each other and do more than just your case. You did everyone's case, and once it was approved, I've been very active with Sonoblade prostate ablation. That there's light at the end of the tunnel, that prostate cancer is the number 2 cancer killer in men, but found at an early stage is very treatable, and that there is light at the end of the tunnel, that it's a process. The patience is very important, and that as with good communication, with good quality of care, with good therapeutic treatment, with good therapeutic options, that those patients would do well. They just need to know what their options are and to treat and to choose and to make a choice based on themselves and not so much what they hear, but their decision. And once they understand it, and once they have good communication with their physicians, then they'll be okay. Every man should be responsible about not just his life, but the people that love him. And one of the cultures of men is the fact that we do not want to be vulnerable. And because we don't want to be vulnerable, we tend not to want to get involved in our care. We tend to kind of put our head in the sand and hope things work out. But being a man, we have to be responsible not just for ourselves, but for our families and the people that care for us. There are options in prevention, there are options in treatment, and the early we know, the better. So the prostate cancer screening is so important. What I've always not really understood was the fact that more men get colonoscopies than go check their PSAs or get their prostates checked. Colon cancer is the number 3 cancer killer in men. Prostate cancer is the number 2 cancer killer in men, but yet there's more information and more education about colon cancer instead of prostate cancer. So yes, I feel men need to be more aware and they need to be more responsible about taking care of themselves and their health. The earlier the better. Prostate cancer screening, if you have a family history or you're African American male, you need to start getting checked at 40. I recommend getting checked with the PSA and a digital rectal exam annually. And I recommend also informing your friends and your family that they need to be checked. So the most important thing with prostate cancer is early detection. But also the kinetics of the PSA is important. So you need to be able to compare your PSAs annually to make sure that it's not going up too high too quickly. So you're not waiting for that magic number as to the magic threshold. You can actually find it early based on the kinetics of your PSA. Prostate cancer in African Americans, we're genetically more inclined of not just having prostate cancer, but also dying of prostate cancer at an earlier age. So it's quite important that all men, regardless of race, with a family history, need to get screened at the age of 40. But African American, because we're higher risk, need to be screened at the age of 40. It is so important because early detection can improve outcomes and reduce morbidity and mortality. So, in light of that, the awareness of prostate cancer as the #2 cancer killer in men, with the majority of those men being more African Americans than other races, requires that we get screened earlier. Okay? I've always felt important that more men, regardless of race, get more colorectal screening than prostate cancer screening, even though colorectal cancer is the #3 cancer killer in men and prostate cancer is #2 cancer killer in men. So my answer to that is better prostate cancer education, not just for African Americans, but for all men. But more important, stressing the importance of also getting screened at an earlier age, especially for African American men.